No, little girls were hurt in the making of this video, but hair was lost.
Dr. Young! Dr. Young! Wake up! There's been a car crash. It's an emergency.
Is it an emergency or is it an emergency?
We need you now.
Okay, I'm coming. 2 a.m. People want to be getting in car crashes. This is not what I signed up for. Okay, nurses, where is this Why is our patient on the ground? It's too heavy. Well, let's get this patient to the CT scanner stat.
So it turns out this is an actual emergency. Right now, we've got our patient in the CT scan so we can scan her brain, and we should get the results here in a few minutes.
So we have a problem. There's a brain bleed from the CT scans. I'm going to explain to the family what's happening. So right now, to the left, we see our CT. And to the right, we have a diagram of just the brain of our cerebrum, our cerebellum, and then this is our brainstem. This would be our brainstem on the patient.
So family, there's 2 types of hematomas. There's an epidural hematoma and a subdural hematoma. And this is what your daughter has. You can see the dura is right here. And we have some pressure on our cerebrum, and this is venous blood. Now, if the car crash had caused a fracture and we had a buildup of arterial blood, then that would be a form of the epidural hematoma. But right now you have a subdural hematoma, and we are going to have to operate immediately to remove the pressure.
We're now in the OR room, and our patient's on the OR table. For just a subdural hematoma, I'm just going to use the regular bed. And I'm going to move our patient all the way up. Going to take our headpiece off. And we have this thing right here called a horseshoe. And this is what her head is going to be on. It's going to sit here right perfectly. Now this hair is going to have to go. Stop.
Let's do surgery now. I'm going to eat you.
We got our patient draped and ready to go. But I'm going to need help on this. Where is Dr. Young?
I came as fast as I can.
All right, we'll get suited up. We're ready for surgery. Let's go.
Ready for surgery. All right, team, I need a scalpel. All right, scissors. And now we're breaking through and peeling over this hair and the scalp. And right now there's a lot of bleeding. I need some bipolars. We're going to stop any kind of bleeding with this. Now we have the skull exposed. And now that we have the scalp exposed, I'm going to need a drill. Well, this is going to have to do old-fashioned wise. Oh, look. Here's some blood evacuating from the scalp. I'm just going to push out this clot right here. Man, this blood just keeps coming. And it's looking pretty dry. We're just going to need to wash it out now. Just some water. Just spray it on there. Alright, now we're good to close her up.
Hello, Miss Young. Me and Dr. Young had to operate on you because you were in a bad car crash. We had to make an incision and make a little hole to evacuate this blood clot that was... Yes, ma'am.
Which means you cut my hair?
Your brain is fine.
My hair?
Your hair
My
is...
hair.
Your
My hair.
Hair will survive.
Is it shorter?
It's a little bit
Is
shorter.
it still curly?
It's a little curly.
What you mean little curly?
It's a little curly. Listen, Miss Young, everything will be fine.
Whoa.
Listen, everything will be fine. The anesthesia makes you a little bit loopy. So, I'm just glad you're feeling better. I'm going to go through a little test to make sure your pupils are fine. Oh, yeah, they look great. And can you wiggle your toes for me?
They're a little stern.
Can you wiggle your toes for me? And your other one? All right, perfect. Let me see. Can you wiggle your fingers for me? Awesome. All right. I'm expecting a full recovery. You're going to be in ICU for
my hair, right? It's going to come
There's
back.
no fixing that.
What do you mean? You shaved it. You going to buy me a wig?
I'll buy you a wig. All right. Well, I'll check up on you tomorrow, Miss Young. You get some rest, okay? All right.